Join me, Charlotte Stallworth, Vice President of Business Development and Innovation at Stanford Medicine Children's Health, as we engage the brilliant minds driving change in healthcare, unraveling the mystery behind the next medical innovation. Today, we will explore innovating healthcare through digital health investments, and I am excited to welcome healthcare tech investment expert and new friend, Cheryl Cheng. Cheryl is the founder of Vive Collective, an investment firm involved in improving the access and quality of healthcare by building, funding, and growing innovative digital health and consumer opportunities. Cheryl has led funding rounds and collaborated with digital health companies, including at-home health management tools and telehealth services. She currently serves as an advisor for Stanford's biodesign program, where she instructs go-to-market strategies, providing guidance to faculty and student teams. Hi, Cheryl. Thanks for being here.
Hi, Charlotte. Great to be here. Thanks for having me.
Wonderful. We would love to know about how you became involved in healthcare tech innovation.
Yeah, so I think for most people when they're young, they're healthy and they don't really think about healthcare. They don't think about the healthcare system. It's not an active part of their life. For me, when my daughter was born, when she was about 18 months, we noticed that she was showing signs of strabismus. And so that was the first foray I really had really into the healthcare system. And because it's your baby, you are super nervous when you get a diagnosis. And so even though it was something that now looking back was relatively simple, strabismus, I took her to all of these experts up and down the Bay Area, thinking I need a second, third opinion before anybody cuts into my baby's eye. And in that process, that was the first time I'd gone to specialists. And I saw the waiting rooms, the lines that were just like out the door for what was a 10-minute doctor visit. And I had the luxury of having a job that gave me that flexibility, but I saw in the waiting room a lot of people who did not. And that made me think a lot more about where in healthcare people were lacking access. And that brought me actually to the Stanford Ronald McDonald House. And I served on the board at the Ronald McDonald House for about 6 years. And there we saw so many families coming from all over the world, primarily west of the Mississippi, but people who were coming to Lucile Packard for rare disease treatment, oncology, live organ transplant, you name it. And while they got their health care at Lucile Packard, Palo Alto, as you know, we live in the area, is very expensive. And so the Ronald McDonald House became this bridge of housing, services, other things to enable the delivery of healthcare. And my role as a venture capitalist at that point was not looking at health tech investments. We were looking at fintech, enterprise software, mobility. And I started to see the Ronald McDonald House pilot some of these technologies in the house to enable better communication between the family members who are staying at the house, the family members who are left at home, and just getting information and access to expertise that, they're displaced. And so that's when it really triggered for me the opportunity to leverage some of the stuff that we were doing on the venture capital side outside of healthcare into healthcare. And that's where I started making a few of my first investments.
Wow, I really love that. I think, a lot of innovators and people in this space are motivated by a personal story, and I really appreciate you sharing that with us. And especially understanding the innovation that has happened because of the Ronald McDonald House, which does amazing work at Stanford and many other places across the country. Could you tell us a little bit about Vive Collective's role in development of digital health companies as you're looking at access and making it easier for families to engage in the healthcare, experience that's required for their child or for themselves?
Yeah, absolutely. So as you know better than anybody else, and I love learning from people like you, how complicated healthcare really is, right? From the alignment of incentives, public policy, the sensitivity of data privacy, because you are dealing with people's healthcare data. it's just very, very complicated. And so it's difficult, I think, if you zoom out from my perspective, I'm a financial investor. And when I'm in a partnership with people who are doing fintech, enterprise software, consumer, we're all debating about apples versus oranges versus gorillas in terms of which do we put money into, and they're very difficult to compare. So the mission for Vive is to have a team that's 100% focused on healthcare all the time. And everybody on our team has an operating background. We have built and scaled products in the past. We bring that expertise to helping our founders. And so one side of our operations is traditional investment. The other side is what we call the collective, which is a set of executives from health systems, payers, pharma, where we can trust them and tap into their expertise to know how to evaluate and help the companies that we invest in. And that, I think, is very, very important, because usually innovation does not die, in my opinion, because the code doesn't work. The code can be fixed. The problem is the time to market is too long, you run out of money. You're not selling to the right stakeholder, you don't get large enough contracts, you don't make enough money, you run out of money. So it all kind of comes down to, do you have the runway and make the right connections to allow your business to scale? And so we want to bring that insight, and that's how we think about it, in addition to the checks that we write.
I really love the description of the collective, bringing those people with expertise to advise the startups and the people who are creating the new technologies. I really think, we've had conversations offline before about the importance of the business model and the structure. And as you talk about, the runway needed, considering that model and all of the elements that are required to go from the point you're at to the desired, commercialization, it's
Yep.
really important to lay that out. So thanks for describing how you're approaching it. How do you identify the need for innovation in healthcare? There's so many broad areas to innovate in. And I think as there are a lot of startups and also tech companies, even retail companies, looking at what needs to be innovated in healthcare. So how do you identify those needs?
Yeah. I mean, the reality is I don't think you can throw a rock and not hit an area that needs innovation in healthcare, right? But I don't think it's about that. I don't think it's about saying, oh, there's a need, because everybody who comes in to pitch us has identified a clear need. And technically that need is pretty big, right? On the order of hundreds of millions of dollars of opportunity. The way I think about it is, one, is the need acute enough right now? And so we think about a 3 to 5 year horizon, and we say, is this something that Charlotte is going to need to buy today, or needed actually to buy yesterday, so that when you present to her, she's like, oh my God, I've always been looking for this, right? Like, that's the ideal. So timing is really important. Then we also think about policy and regulation, right? So yes, maybe there was a need for innovation, but the current public policy and regulation framework is just going to make it so incredibly difficult that innovation is not going to happen in the next 3 to 5 year timeframe. And just to reiterate, we look at digital health and health tech. So I think of that very differently than if you were doing research in therapeutics, for example, or medical devices. So my horizon is shorter because I'm looking at technology and primarily software-driven technology. So I want to be very clear in that caveat, because I do think that's important. And then the last thing is really honestly around business model, right? Like, I see so many ideas, and you probably have as well, where it's not a new idea. Managing diabetes is not a new idea. The problem is the consumer ready to think about it now? And one great example for me is in women's health. Like, for years, people have talked about women's health innovation, specifically also talking around menopause. And I mean, menopause is not new, right? Like, I mean, this is from like the
No.
dawn of time. So why we're finally innovating on it now is, befuddles me. But, finally now employers are looking at it and saying, oh, like, we have female employees who are going through menopause and could use support, right?
Right.
Payers are now starting to realize that there are products, services, there are therapeutics coming down the pipeline that could actually improve a woman's journey through menopause and have healthcare and have health outcomes. So maybe it's just the time is now. And that is unfortunately one of the criteria on how we prioritize what we would look at and what there is a need for today versus maybe what we would look at 7 to 10 years from now.
Yeah, definitely. Timing is everything, I think, in
Everything.
innovation and business development, right?
Yeah.
Really understanding what people are willing to do and if the technology is suddenly available to make that happen, right? So maybe, tech has advanced to a point where you really can engage the individual in managing their health by, wearables and other items
Yeah.
that really help them to move forward. So I think it's that timing of the need, our desire to do something about it, and the tech being
Yeah.
able to meet that need. So
You're
um,
you're so right. I mean, I think the first one for me was smartphone, right? So
yes.
6 or 7 years ago, when I made my first investment in digital health, it was because we saw smartphone penetration in the US hit a level where basically everybody had one and was proficient enough in using it and trusted the hardware platform. And when you have what I would call shifts in platform technology, going from the laptop PC to mobile, that was one shift that would unlock all kinds of innovation because developers would rush in and build things. The next one I think is AI. And that will give us the opportunity to build a lot of applications that we in the past weren't able to do because compute was so expensive or not even possible. So I think that's another unlock. Still early days,
Yes.
and there's a lot to learn in that. But I think you're absolutely right. So that's where we're going to see big shifts in explosion in innovation.
Yeah, I definitely agree with that. The technology is like the catalyst for additional innovation and kind of even turns almost every person who has an idea, that technology is at their fingertips, right? Even with AI, like you say, early days, but still we have the access to create an AI tool, right? So it's I think very empowering and interesting to think of all of the interesting ideas that our fellow citizens have and how those can be applied to healthcare and other industries, to better our experience as humans on this planet, right?
Totally. So I think about this a lot because I think for many years, technology was maybe innovating faster than science in, when you think about what computing could do, mobility, the cloud, et cetera. And sometimes as investors and technologists, we felt like we were dragging doctors along, right? We were like, come on, please use this, right? Like it,
Yes.
but now, in certain areas, like one area I'm spending a lot of time in right now is oncology. And in oncology, the volume of science, innovation, and discovery that's coming out is faster than what the doctor can process, even if they spend all day reading journals. And so this is where I'm like, wow, like science actually has produced more than technology was digesting, and we need to catch up. And oncology is a great area that I think, look at all the papers that are coming out. How can we be indexing them, making that information available, best practices to even a community oncologist that isn't sitting in like a City of Hope or Stanford or, large academic medical center, so that we can deliver that precision treatment to everybody who needs it, regardless of where they are. And they shouldn't have to travel to Palo Alto or Pasadena or, wherever to get that treatment. I think that is so exciting and compelling.
I love that, and how technology can enhance a physician's ability to care for the patient and really improve or, decrease inequities and improve outcomes for people no matter where they live. And so that leads me really to my next question about your perspective on using digital health to improve access and quality in healthcare, and how does Vive contribute to that mission? I'm
Yeah,
sorry, Vive.
so
I apologize.
that's
Vive.
okay. There is a conference called Vive, and everyone confuses us. Um, so I think of access. So most people think of access as physical access, right? Like, do I live
Yes.
within 35 miles or, whatever reasonable traveling distance? And I think that is definitely one definition of access. And if you think of tools such as telemedicine, that democratizes access because now you no longer need to live within 35 miles. The other is I actually think about access as being able to deliver care in the moment that people need it, in the way that they will receive it the most. And so what I mean by that is, I think I read a stat somewhere, and I could be wrong, but something like 80% of healthcare decisions in a family are made by women, by the mom in the household. And so today, when you look at the number of dual income families, the number of women who are working, and I know how many times I have gotten home from work just to find out that my kid has a fever, sore throat, whatever. And it's like 5:30. And I'm like, I know the clinic closed at 5 p.m. Right. And so it's
Right.
just, and so this is where access is not just about, I'm within physical proximity of large health systems, but my time and my schedule don't allow me to fit into the way traditional healthcare operates. But now with telemedicine, remote monitoring tools, all of that, I suddenly do have access. And so I love that. I also think that there is this interstitial layer that digital health has the opportunity to play, which means you don't always need to talk to an MD for everything. There are things that nurses can help you with, coaches can help you with, nutritionists can help you with, but you don't always know as a patient. So like your first instinct is, let me go find the doctor. And so this is where I think digital health tools can be very, very powerful in making that interstitial layer more accessible for both the physician as well as for the patient. And sometimes that's through the mobile phone and telemedicine. It could be through asynchronous text messaging. It could even be just through empowering the caregiver at home to be able to do more. So I think it's all of that. And then the other area of access that I think about that a lot of people I think forget is allowing the providers to work at the top of their license and creating technologies that remove some of the busy work, some of the process that has already been embedded and calcified into the system, and allowing the provider to do less of that redundant work. So we are investors in a company called Somacare, which is in prior auth and benefits verification for medical benefits. So therapeutics that have to be infused and injected in a doctor's office or in an infusion center. These are expensive drugs, sometimes costing over $50,000, $100,000 a year. So you have to get those prior auths done in order to administer these medications. That is a tedious back and forth process for an administrator in a provider group. And so we can make that faster, more accurate by being embedded in the workflow of the provider, which is what Somacare software does. It just takes pressure off the system. And that has a trickle down effect of improving access to the therapeutic because the doctor's already seen the patient, right? They've already decided you should be on this medication. So we think about access in that way too.
Yeah, I definitely appreciate that. Your kind of broader view of what access is and how you improve access. It's not just being able to see the doctor from home. It's really being able to create efficiencies in the system that allow the process of treating patients to happen more quickly to the benefit of that patient. So I really appreciate that. And that's something we're looking at in our work as well, as what does access mean? And actually, I've been talking to my team about that as well, as we look at one of our primary focuses this year, at Stanford Children's, is equitable access. And what does that access mean, and what kind of initiatives fit into that scope? So I really love the way you've described it.
And I assume like you also probably have been thinking about like what does culturally relevant access mean in certain communities and populations as well, right? Like and that's another area I think digital health has the opportunity to really impact. And that's so much more than just being translated into Spanish or Chinese or whatever. It's having providers that you identify with that understand your culture and can speak to you as a patient and as a family in a way that resonates with how you live.
I definitely agree with that. That is something that we're looking at in all areas with our own teams, and how we're, expressing ourselves to the community, right? So that people don't think that only certain kinds of people could come to Stanford or other healthcare systems, right? We're here to care for the communities, and we want everyone to feel welcome and comfortable coming in and receiving care. And our outreach is really focused on that. It's really fair and equitable outreach to the communities. And I think, we really have to kind of break down some barriers, and all of us in healthcare, I think, have a lot of work to do, but I think we're seeing some of the benefits of the early work that's being done.
That's amazing. That's exciting.
Yes. So, one of the things I also have been thinking about and talking to some people about is really kind of incentivizing, or somehow making it a matter of course that people will consider equity and access when they're creating their technologies and as they're building their companies. And as you know, typically when you're building a startup, because you have investors and you need to show an ROI, you really focus on the biggest market first and getting returns in first, and then moving on to some other areas, maybe considering equity later, right? I wonder your thoughts about, maybe ways to build in that kind of consciousness and maybe incentives to do that early on. Has that been something you've thought about or have seen?
So yes. So what I'll say is what we're seeing today in the market is we're seeing startups sort of pick a couple different paths, right?
Okay.
So for the first time in probably 10 years, I would say we're seeing companies start from the very beginning saying we are a Medicaid company. We are going to, we are only going after Medicaid contracts. We are going to structure our clinical model in a way that is, going to allow us to win the RFPs for Medicaid contracts. And so as a result, they are naturally thinking about equity from day one, right? Because they're going after Medicaid. And then in other cases, what we're seeing is companies know that they need a certain body of clinical evidence before payers are even going to pay attention to them. So they're starting direct to consumer because they can catch the low-hanging fruit, knowing that they're just going to do cash pay, and then they'll get the first, 5,000, 10,000 patients so that they can actually have data that's showing we're generating health outcomes. Let's not worry about how they came onto the platform, but we're generating quantifiable health outcomes. And then they take that data and then they go to the payers, and then they start building towards that strategy. So I do think that what we're seeing is very savvy entrepreneurs today, those who either start from day one saying we're going to go after equity through Medicaid, or we know we're going to evolve our business model over the next few years, and watch us go through that evolution. And either way, they are focused on what they know is going to matter in a Medicare, Medicaid environment, which is the health outcomes that can prove 3x ROI. And so they are thinking about that. There are others that are just going after populations that from the get-go are underrepresented in healthcare access, and whether that is cash pay or through employers, it's part of their strategy. So I think we're seeing that in general, because we all know that those populations are sometimes the most expensive in the system. So it's both for business reasons, but then I also think for social and equity reasons as well.
Right. I agree with that. And maybe with this approach over time, those previously underserved groups won't be the most expensive, right? Because there'll be ways to kind of even that out. I appreciate
Yeah.
that.
But I do think, by the way,
Yes.
one thing I would say in access is it in some of these populations, it's not just about access. It's not just that they have a mobile phone, right? You actually have to demedicalize healthcare for these populations. Like, for example, um, hypertension, it's the silent disease. You don't feel it, you don't see it, but you could be hypertensive, and then one day you're going to have a stroke or a heart attack, and you never saw it coming, right? And you
Right.
have to educate people on, like, what is hypertension? Don't be afraid of it. You can take these baby steps. And so the way that these products are designed actually have to be very consumer oriented if you want them to address the equity problem, because you need to be able to demedicalize these conditions so that people aren't afraid to own them and address them somewhat on their own.
I agree with that. And I appreciate you bringing up, the consumer, thinking about the consumerism because you consumerize that. I think that approach in healthcare is a little bit different, right? Because you're really typically thinking about a patient who is ill. And if you think about a consumer or a client or however you want to name it, I think that changes it a little bit because then you're giving information not just to a person who's ill, but maybe a person who falls into a category who may, like you say, have hypertension, right? And then providing information to them, making them have more ownership of their health, right? And you're partnering with them in that. So I really appreciate that. And I think we're going to see that a lot more, of course, as you see retail companies and other types of
Yeah.
companies innovating in healthcare as well. But we are all consumers and potential patients, right? So I think we understand that kind of duality in ourselves. And that really helps to put on that hat when you're innovating in healthcare and thinking about, well, how would I want to manage this myself? How do I want ease of access and information and, all of that coming to me? So I think that's really what we're seeing. And I think that's going to help make a big difference as well and give us that evidence-based information that we need to kind of build and scale some of those solutions.
Yeah.
So could you tell us how fostering innovation in healthcare contributes to more patient-centric approach? We're talking about that a little bit and maybe some of the benefits that it brings to individuals seeking medical care.
Yeah, so I'm going to be a little bit biased here because of my
Okay.
background. A hardcore engineer may disagree with me, so I'll caveat that. So I spent a number of years in my career doing new products and innovation at Clorox, in a joint venture between Clorox and Procter and Gamble.
Okay.
And I know that for folks in healthcare, they're going to be like, well, that was consumer packaged goods. Like, what does that have to do with anything in healthcare? And I spent a lot of my time going into people's homes and doing interviews and watching how they cook food, how they stored food, how they took out trash, which was, largely food scraps. And doing those in-home visits was a very anthropological view into how people think about their families, their relationship with food, therefore their relationship with health. And I really, really believe that if we want to impact behavior change, we need to put ourselves in the shoes of the consumer, because the consumer is the patient. Now, this is going to be for technologies that are consumer facing. If you're talking about revenue cycle management in like a hospital, then like it doesn't matter, right?
Right.
But if you say, you know what, I want to help your child and you manage autism, right?
Right.
And you really need to understand the parent's journey in terms of the number of ABA therapy sessions they go to, speech, OT, like, just how consumed their lives become because of a condition that their child has. And so until you understand that and like really understand those needs gaps and where you need to meet the consumer, it's difficult to know what you need to build and how to prioritize all the different features. And then more importantly, I guess for us as an investor, what are people willing to pay for? So, it's this cycle, and some people think of it as a vicious cycle. I'd like to think of it as a virtuous cycle, where if you can nail the insight, you will get the consumer behavior that will drive the engagement, that will allow you to collect the data that you need to develop more solutions that will engage, and it's going to go around. And when you can close that loop, you have a business that's going to make money. Because engaging that patient continuously, and it doesn't have to be every day, but just continuously enough, is worth gold to everybody, the health system, pharma, payers, because that's where everything's broken right now. We're episodically seeing patients, right, and a lot of times they're just running into the ER. And they're using their ER as their primary care when like they really shouldn't be. So that's what makes me very, very bullish and a little bit dogmatic on being consumer oriented in the way solutions are designed. And again, this is for a particular type of solution. Right. I feel differently for like back office, like health system payer oriented things. But for a lot of aspects of digital health, I think the consumer journey is very important to understand.
I agree with that. And, the way you've described it is really, a lot of the values built into design thinking, agile software development, really bringing in the end user, considering them upfront. And so that you have end up with a product that is actually they will use, that they will purchase, and that makes a difference, right? That results in what your vision was for it. So definitely appreciate you bringing that forward. Could you, discuss how Vive Collective identifies and evaluates potential investment opportunities in the healthcare sector and the criteria that are crucial in your decision-making process?
Yeah, so we take a top-down and bottom-up approach. So I mentioned earlier we have the collective, which is our group of executives, and we rely a lot on them to understand needs. So just like we were talking about doing this like anthropological work, if you were a startup, like we do that as an investor as well, right? Like we want to understand what are your hair on fire issues as a buyer of technology. And so we use that to inform whether we believe when a founder comes in to pitch us that they're really solving the problem that we know that the buyer wants solved. So a lot of times founders will be building A, and then when we talk to people in our collective, we realize that they want to buy A prime. And so it's not like they want to buy B, but you just got to tweak it a little bit. And so part of our criteria is evaluating whether the founder and the management team really understand the problem set that they're going after, and does it match with what we're hearing in the market. The second is we do really evaluate the clinical models. So I am very fortunate to have 2 MDs on my team that critically look at, does that clinical model work to deliver outcomes? And that is everything from, not just does it work scientifically, but also, what's the lift? Like how much behavior change are you asking for, both in the system and in the provider and the patient? And if it's too big, then that clinical model is putting too much burden on one party or the other, and it's going to break down. Then the last thing I will say is we generally look at companies that are a little later stage. So, generally doing 5 million in revenue or more. There's some cohorts of patients that we can really look at that have gone through the platform. And so we're looking at unit economics as well. And wanting to understand what is the profitability of bringing in every patient or every customer, and how will that change over time? So I do think that it is unwise for founders to think about using venture capital money to subsidize the unit economics for a long period of time. The first couple customers and patients, of course, but the unit economics have to be pretty healthy by the time you get to $5 million in run rate, right? And so we do look at those financial metrics pretty closely.
Yeah, I appreciate that as well. The business model and the metrics and the criteria for investment are important. And of course, there are those earlier stage companies that maybe we tend to see coming in to Stanford and other systems wanting help with that proof of concept and getting those patients on and some pilots to gather that data and reach the stage at which you might be able to guide them further along in their commercialization process.
Yeah, I do think one of the things we really look for and why I like working with people like you and like others in like health systems and other places, I want to understand if these companies are going to get stuck in like what I call pilot purgatory, right? So, willingness to do a pilot, but then going from pilot to commercial contract is a whole different ball of wax. I mean, I'm sure, you've seen dozens and dozens of startups get stuck in that space. And so while we don't need to see every single pilot convert into a commercial contract, because sometimes there's issues on the customer side, it has nothing to do with like health outcomes, but we do want to know that they can cross that chasm. And for some reason, I do think that in healthcare, that chasm can be pretty deep. And we want to make sure that they don't get stuck in that spot.
That is a real concern in healthcare. I think there are typically, historically, a lot of layers to go through to convert that, and maybe the expertise on a pilot and the business expertise are separate. I think fortunately for me, I feel lucky in my role that I manage our business development and innovation on an aspect of our work, so that I can, when I'm speaking earlier this week with a startup company, talking about structuring a pilot, but also thinking about what that conversion looks like, and is this something Stanford would buy? And for me, I think it's incumbent upon me and others in my role is to look at the entire journey up front and not just say you're doing a pilot, because you need to understand what the goals are there. And if it's not something the organization is going to potentially buy, I think explaining that up front, maybe
Yep.
providing some guidance and really kind of partnering to help people understand that. And I think if you're going to say no to something, or if it's not going to work, it's really important that we give that information up front. Or if
Yep.
people are, like you're saying, if it's not project one, but 1A or another version
Yeah.
of that we would need, that would be better, that we're looking for, we provide that information as well. So it's really kind of a synergy, and I appreciate working with you as well. And it's always fun providing guidance and also hearing about the amazing ideas that people are approaching us with. It's it's an exciting space, I think, for both of us.
Founders are lucky to have somebody like you in that role, right? Like a lot of times when they approach customers, they don't necessarily have somebody like you that can help them do that translation, or say, hey, you know what, you guys do qualify for a pilot, but you are not going to be able to qualify for a commercial contract unless you are able to do A, B, and C, right? And a lot of times they don't have that insight. And so that was one of the things, going back to like, why did I start Vive, and, what do we hope to achieve, is we hope to reduce some of that friction, right? We hope when a founder comes to us and says, I have this idea, I'm going after these group of health systems, we can say, all right, you know what, in our experience, like, these ones have a Charlotte at the table. You should talk to them because, she'll help you, right? Like, these people are, they're there to help you. In others, like, they really don't know yet. So we hope to reduce those cycles. And in other cases, just make introductions to people that the founder may never even have thought of, right? And so we may say, hey, you know what, you should talk to Blue Cross Kansas, because we do know that they're looking for something like this. And we're happy to make those introductions, because we do think whether we invest in the company today or later, or maybe potentially not at all, there's so much work that needs to be done in healthcare. We want to be a part of fostering that innovation anywhere we can. So it is hard, like it's a pretty long journey to start something in digital health.
It really is. It is a long journey. And yeah, I think there's a lot of collaboration needed to make that happen. Would you like to speak more on your approach to partnerships and collaborations that Vive uses to achieve its objectives?
Yeah, so our idea of partnership is really based on relationship more than anything
Okay.
else. We think that trust and relationship are sort of the foundation for good partnership. So we're very lucky in the sense that we have a capital partner that allows us to do very flexible check sizes and deals. So we can look at early through growth. We can write a $10 million check, we could write a $50 million check, we could write a $100 million check if the opportunity is right. So we're very, very fortunate from that standpoint. So all of our energy when we think about partnership on the ecosystem side is going out, doing a lot of listening. We do host a number of events throughout the year to bring our ecosystem together, to share, and we want cross-pollination. So we would want somebody like you in a health system to have conversations with people on the pharma side. It doesn't seem like something that would be natural partnerships, but there are definitely places where all the main stakeholders in healthcare need to understand and find. Sometimes it's only collaborating in children's health, right? Other times it's something else. And we want to foster a lot of those relationships. And we have a person we have a chief platform officer. She was actually the first person I brought on when we started Vive, because I felt that those partnerships are so important. And I would say it's grounded in, we will send them opportunities once we know this is what they're looking for. And then in return, they send us opportunities and we look for things projects to work on together. So that's kind of how we approach it. It's a little bit looser than, I think, we don't have MOUs or LOIs, or we don't do any of that kind of contractual stuff. I don't think that we need it, but we do feel like we stay in pretty good regular contact with all of our partners and advisors.
That those relationships, even if you're saying they're not contractual, they're still, I think, very important in building innovation in healthcare and in other industries. I think innovation and collaboration go hand in hand. There's not really much innovation you can do, I don't think, kind of in a bubble of one.
Yeah.
So can you tell us how Vive Collective stays ahead of trends and innovations to make informed investment decisions?
Well, it's a little easier for us because we are not first money in. So we
Yes.
kind of stay on top of things actually through our peers and compatriots that do earlier stage investing. And we do spend a lot of time meeting with and staying on the radar of angel investors, seed funds, earlier stage investors for that purpose. And then again, bringing it back to the collective again, we get a lot of insight from our collective partners in terms of, these are the things that we're going to be needing to buy over the next, 2 to 3 years. So that's how we identify opportunities. And then we also, well, for good or for bad, I will say healthcare is driven by regulation, regulatory and policy. And so we do keep a pulse on how is regulation and policy changing, right? So for example, is there reimbursement risk now in certain categories? And so we need to steer away from certain spaces. Is reimbursement opening up? Are there, mandates from either the federal or state level that, say, funds are being moved more into pediatric behavioral health, for example, which they are, because we're seeing this crisis among our children. And so we use that to inform where we see opportunities bubbling up. But, as an investor that is not first money in, we have the luxury to see what is getting funded, I would say 2 to 3 years earlier than when we would invest.
That is an advantage. So are you focused on any specific regions, or do you operate on a more widespread scale?
So invest in a team that is based anywhere,
Okay.
technically. However, our criteria is some companies that have a US go-to-market, that are really thinking about accessing the US healthcare system. And honestly, it's mainly just because that's a system that my team and I know. Healthcare is tricky enough in the US, and I would not even feign to know, like, how does it work in France or Turkey or, Japan. And so it's just really difficult to be a smart and savvy healthcare investor outside of your domestic region. It's not that eventually those companies couldn't go back to those other regions, but I would say we also wouldn't add as much value, to be honest, other than our money. And we want to make sure that people include us in their company and on their cap table because they think we can add a lot of value to their growth.
Right. It is important to have a good match in what you're looking for, as a VC, and, what the company strategy is and their go-to-market kind of vision for themselves. So can
Yeah.
you tell us, like, what advice would you give to aspiring entrepreneurs or investors looking to make a positive impact on healthcare or the healthcare industry through innovation?
Be patient. It's a journey. And I think, so one, I think is be patient. I think two, be realistic, right? In terms of don't assume that everything is going to fall your way, right? Like that you can't have something that depends on regulation changing in your way in the next 2 years, plus this, plus this, plus, like that's kind of potentially a recipe for disaster. I also think that for founders in particular, really understand the need, right? Like I see founders will come, they'll present this really large number on their slide deck around like the TAM, the, total available market. And I'm like, but that's like all of radiology, right? Like, I mean, it's like the
Yes.
machines and the packs. I was like, that's not like the software layer that like, or like the AI layer. And so like, really, really hone in on like, how big is the market that you're going after, the real available market to you. I think that's really important. And even if you're starting a company, think about like, what are the exit possibilities for your business? And of course, everyone wants to go public, right? Everyone says, oh, like, we're in this to be a public company. The reality is that most exits, and they could be very successful exits, happen through M&A. So who are going to be the potential buyers for your business? And what would they buy this business for, right? There is a natural arc to these products and businesses, and maybe the natural arc is you could exit for $300 to $400 million comfortably if you did the right things. That's fine. But then that means you need to capitalize your company with the right amount of money. If you need $100 million into the business to generate a $300 million exit, that's not a venture return. And so what I tell founders all the time is really think about whether you have a venture return business. If you don't have a venture return business, you can still have a healthcare business. It just means that you're going to fund it differently, and you're going to think about profitability differently, time to profitability differently, and that is perfectly fine, right? There is nothing wrong with that at all. And you can make more money as a founder personally than if you raised venture money. So I don't really actually think that the only way you can build a successful healthcare business is through raising venture dollars. So that's what I encourage people to think about as they think about investing in this category, both as a founder or as an investor.
I think that's, of course, very sound advice. Really understanding that venture capital journey is not for every business, right? So really understanding kind of the match. Do you find that those entrepreneurs that are coming to you have framed their ask in a way that supports what they're presenting, like when they pitch, and then the ask that they have of you, that sometimes those are not aligned?
Yeah, they're sometimes not aligned, for sure. It happens. Uh, I think the market, so we're sitting here in February 2024, right? So the market has gone through a correction over the last 2 years. We may be sort of at the bottom of that correction now, and we may start to see some recovery.
Right.
But what that really means is valuations were probably much too high a couple years ago. They were definitely too high, and the companies cannot grow fast enough to be able to grow into that valuation before they need to go out and raise more money. And that's what we saw. And this is where you're seeing companies now raise money in down rounds. We're seeing companies have to raise less money. And this is where founders feel like they're really in a squeeze. And they are in a genuine squeeze, because if you have to do the same amount with less money, how do you do it? And the largest cost center in startups is personnel costs. And what we see now still, and this could be a combination of inflation. I have lots of theories, right? Of like whether this is inflation, Silicon Valley cost of living, like whatever it is, like salaries are still really expensive. And so founders are not able to do as much with less money, because employees are just costing that
Right.
much more. And so I think they're in a bind, like, they're in a genuine bind, which puts us as their investors in a bind. But I do think that there's going to need to be more correction in how capital efficient companies can be. And that could either mean your employees, you're finding ways to get employees and talent for cheaper than what they might cost here in the Bay Area, or you have to develop business models and pricing models that generate more revenue quickly. But that is a sad reality of today's times, because the money is not flowing as readily as it was in 2020 and 2021.
That is good to know. And, adjustments have to be made, but of course, the innovation continues, right? And we continue to move forward. So we're getting close to time. It's been a pleasure having you here today. Could you maybe give any final thoughts you might want to give to our audience of, entrepreneurs, innovators, providers, regular consumers who are interested in this space?
I think people should do it, right? I think healthcare, I mean, listen, we don't really have a choice if you think about it, right? Like this is one of the largest GDP categories in our country. The costs are ballooning. We are losing providers left and right. People don't want to go to medical school. Policy is only making things more difficult. So we have no choice but to start to use technology and innovation as ways to release some of that pressure that's in the system, right? And
Right.
we're all human. We're not getting healthier. We're living longer. So we have to do this innovation, right? Like we don't have a choice. So I want to see people come into the field. We've done a couple things at Vive to try to foster that. We have a physicians who VC group where we are trying to bring physicians who are thinking about investing and maybe being an entrepreneur themselves. And there's a Slack channel that we've got, and we use that to just sort of foster conversation, right? We do a bunch of different things. So I really do want people to come into the space, but I want them to do it thoughtfully and in a smart way, so that there isn't scorched earth at the end of it. And then, the natural state will be, oh, we better not do telemedicine, or, we better not do remote monitoring, or, whatever that is. So I don't want to see that happen. But I do want to see more people come into the space and find creative and hybrid ways to do so. It doesn't have to be the traditional startup plus venture funding to do something innovative.
Right. Kind of innovate on the innovative way you're moving forward. So,
Yeah, or innovate from within, right? Within a
yes.
Stanford, within a UCLA, right? Like I think there's so many, this is why I love being part of the biodesign program at Stanford, is because I see these faculty, fellows, like they're carving out a portion of their time that they really don't have, right? Like, I'm like, how do you do
Right.
surgery all day? And then you do, you're doing this stuff in like research and lab, but they have a passion for it. And if they have a passion for it, let's give them the tools and the resources and, access to all of that. So that's what I hope to be able to do, even in a small part, for those who want to go into this foray of innovation.
You're doing an amazing job. And I'm sure our physicians and nurses, IS people, other people listening to this are inspired by the work you're doing and your words. Thank you so much for being here today, Cheryl.
Thank
I've
you for
really
having
enjoyed our
me.
conversation.